I appreciate you taking time to join this webinar. My name is Christy Strauss. I'm a broker sales manager at Insurance Advisors Direct, and I'm pleased to have with you today presenting, and that is Kevin Cox from HAP, and he's going over the opportunities to grow your business post-AEP. So he will talk about the HAP plan. We have everybody on mute, so we need you to use your chat box to ask any questions. Kevin can stop along the way, or, if we will maybe wait till the end of the webinar and address those questions. So, Kevin, go ahead and get started, and we'll go from there.
Awesome. And I do want to apologize as well. I'm sorry we had that little glitch here in the beginning, but I'll make sure that we get through this content in an efficient amount of time so you can get on with your day. But I do want to thank Insurance Advisors Direct for inviting HAP in to come in and be able to present this information to you. Hopefully you find the information valuable, and really it's designed to give you and show you some of the opportunities that are available to continue to sell Medicare Advantage, even though we're outside of the the annual election period. But as a reminder, AEP, we all know, ended on December 7th. We had a successful annual election period with our partnership with Insurance Advisors Direct. So we do want to thank you for all the business that you did right with us, and we do look forward to continuing to work with you throughout the rest of the year. But as we move through here, we just want to recap with you kind of the annual election period performance that we had. We're going to go over why you would want to continue or consider selling HAP to your clients if you're not already. And then we're going to talk about the Medicare Advantage open enrollment period, which we are into right now, that started on January 1st and runs through March 31st. And then we're going to go over some additional SEPs that some agents may not be 100% familiar or comfortable with, or maybe you just need a little bit of additional brushing up on, which will give you some opportunities to sell throughout the rest of the year. And then we'll go over a retention strategy that we will be doing throughout OEP and the remainder of the year to help you retain your book of business and service your clients. So before we jump into the presentation, I just want to recap that as we mentioned, we did have a successful AEP at HAP. We were actually about 148% to our overall goal. So we did exceed our expectations, and we do thank you for contributing to that. The agents brought in a significant portion of the business, so just about 70%. And then to give you kind of an idea of what sold with HAP, of all of the new enrollments for Medicare Advantage that came into our health plan, just about 80%, just about 90%, I apologize, went into our $0 premium plans. So we do have several $0 plans for the clients to choose from, but if that helps you or if that gives you an idea of what other agents are selling, most of them went into the $0 premium products. So let's take a look quickly at our service here. I just want to remind the agents or recap that we are not able to sell our Medicare Advantage plans across the entire state. So we have a service area of 34 counties, and we have two different buckets that we bucket them in. So we have the counties that you see here highlighted in orange, and then we have the counties that are highlighted in blue. The orange counties is what we consider our core service area. And so when you are selling within those counties that are highlighted in orange, just know that we have an expansive network of doctors and hospitals. So to be more specific, when it comes to the hospitals, we have almost 100% of the hospitals in the network within those counties. The only hospital that we have missing is McClellan-Lansing. So know that we have McClellan Port Huron, McClellan in Macomb, and all the other McClellan facilities. It's just the Lansing Hospital that is not in our network. Other than that, you're going to find the U of M's, the DMC, the Carmanos, all of those other hospitals will be participating with HAP Medicare Advantage products. When we look at the doctor base within those counties, so we're talking primary care and specialty providers, we have almost, or just over, I should say, 90% of the providers that participate with HAP. So just know when you are selling in those orange counties, it is a very expansive network of doctors and hospitals. The other counties that we have highlighted, and they're highlighted in blue, is West Michigan. So as you know, we did move into West Michigan for 2020. This is new for us. We expanded into Kent, Muskegon, Oceana, and Ottawa counties. And we did exceptionally well over there. But I just want to remind you that the plans that we're offering on that side of the state is a partnership with the Mercy healthcare system. So we have partnered with Mercy healthcare system to provide these products. So if you are over there marketing and selling these plans, and maybe your client doctor some of the time in Spectrum or maybe some of the time in Metro Health, HAP is not going to be a good fit. These products are really rich in benefits. They're very comprehensive, but they are designed for the beneficiaries that doctor within the Mercy healthcare system. And then as a reminder, on all of our plans, we do have out-of-network coverage for ER and urgent care anywhere across the country and then also anywhere internationally. So moving through, remember with HAP plans, they're easy to understand and they're easy to use. So on almost all of our plans, HMO plans, we do not require referrals to see specialists. There is an exception with the HAP Primary Choice product and the HAP Choice Medicare plan. Those two plans do require the referral, but all of our other plans do not. We also do not have an in-network medical deductible on our HMO and PPO plans, and we do not have a prescription drug deductible. So right away, we're giving the clients first dollar coverage for both medical and prescription drug needs, which makes us extremely competitive and goes a long way with the beneficiaries. As a reminder, we have extras built in that the member does not have to pay for. So we have vision coverage built into all of our plans. That gives your client one copay covered at 100%. It also gives them $100 a year for lenses, contacts, frames, and so forth. As a reminder for the vision benefit, we do not farm that out to, let's say, VSP or IMED. We use our own providers. So you need to search hap.org and the vision providers, and that will give you access to who your members can go and see to utilize this benefit. The dental benefit is provided through Delta Dental. As a reminder, built into all of our plans, they do get one cleaning, one x-ray, and one exam covered at 100%. We do have an optional rider that your client can purchase that covers an additional cleaning, and it does give them restorative services. There's a low option and a high option available. If your client was new to HAP effective January 1st, it is not too late to add the dental rider. They have up until the end of this month to add it and get a February 1st effective date for those dental benefits. So it's not a bad option or a bad opportunity to reach back out to your clients to see how things are going in the first couple weeks, and then to remind them if they want to add dental, it's not too late to add it, and they have until the end of the month. To add that dental rider, they would just call into customer service and they would do it directly over the phone. It would have no impact to your AOR status. It's the customer service rep that's going to handle that for them and add it onto the policy if they choose to do so. The other supplemental benefit that's built into our plans is over-the-counter. So on all of our plans, over-the-counter benefits are built in. It depends on the dollar amount that they get based on the plan they chose, but it's anywhere between $45 a quarter up to $100 a quarter. And we use a company called Convey Health for this benefit. You may have been getting calls from your clients asking you where the over-the-counter catalog is. Those went out this week, and they should be arriving to your clients within the next week or so. Couple things that you'll want to remind your clients that it is a use it or lose it benefit, so it does reset every single quarter, and they can order over the phone, online, or fill out a form and mail it in. So this is a great benefit for you to be able to do another touch point to your client. So you can always reach out to them and say, I just want to remind you that your plan includes an over-the-counter benefit. Don't forget to place your order by the end of March because it resets on April 1st. So it's a great touch point to reach out to them to remind them that you're there to assist them. And then obviously it can lead to other conversations in regards to maybe referrals or, oh, I've been trying to reach you, or thank you for reaching out to me. So it's a great tool to use as another touch point to reach out to your client. The other benefit built in is hearing coverage. We use a company called Nations Hearing. The member has a $0 copay for the hearing exam, and they have flat dollar copays for hearing aids. So we will cover one hearing aid per ear per year for our members. The hearing aids copays range anywhere between $689 a hearing aid and can go up to just over $1,100. And the way that they determine that amount is based on the level of technology that they purchase for the hearing aids. As a reminder as well, the other supplemental benefit that's listed, that is built in but not listed on here, is the gym membership. So remember, we use Silver and Fit. I think we're the only carrier left in Michigan that's using Silver and Fit. The advantage of that is that Silver and Fit does partner with Lifetime Fitness. So if your client is enrolled with Silver and Fit, they would have access to those gyms. And all of our plans include that gym membership at no cost. So here is a list of our $0 plans. As I mentioned earlier, almost all, there is a few that didn't go with the $0 products, but a large portion of our new business went into these programs right here. What I want to point out to you is a few things before we move forward. We offer a $0 HMO plan. So that first plan you see there, the plan 015, that is our #1 selling product. And then we also offer a $0 PPO plan. So that's the last plan you see listed on this chart. It's plan 011. So just know your client has an option to choose between a $0 HMO and a $0 PPO. The three products that you see in the middle are a little bit different. So the plan 019 is an MA-only plan. So it's a $0 HMO, but it does not include prescription drug coverage. What's nice about that plan is that we do offer a $50 a month Part B premium rebate, and then you can see the richness and coverage of the competitive benefits. The other two products you see there, the Primary Choice and the HAP Choice, those are very rich plans as well, but remember, they have narrow networks, so the primary care doctors are smaller, so they're a good fit for the right person, but just know that those are available as well. I do want to highlight just a couple of benefits on this chart so you can see where we are very competitive when you start to compare us to our competitors. Remember, no medical deductible, no drug deductible. We also have competitive out-of-pocket maxes. We have a competitive hospital copays, primary care doctors, so you can see $10 or a $0 copay depending on the plan they choose. $0 diagnostic labs on all of our plans. Look at the physical therapy, occupational therapy, and speech therapy. $0 copay on some plans, $10 copay on others. You are not going to find another Medicare Advantage plan in the market with a copay that low on the benefits, on that benefit. When we look at the prescription drugs, and I'll move forward to the next slide, we have a very competitive prescription drug benefit built into our products. So remember, there's no drug deductible on any of our plans. We offer preferred pharmacy pricing, and then we also now include a $0 copay for Tier 1 and Tier 2 drugs for a 90-day mail order. Our mail order pharmacy is what is called Pharmacy Advantage, and it's very easy to set up with them to get the members logged in, set up, and get these prescriptions mailed to them. For those of you that are very familiar with our formulary, you know that it's very rich. There are brand name drugs that we cover at a generic level copay. To give you examples, ProAir, Novolin, Novolog, Lantus. If your client is taking those prescriptions, we classify them as a Tier 2. If they were doing the mail order, they would have a $0 copay for those medications. We also cover the generic for Lyrica, so pregabalin, as a Tier 2 copay as well. And then if you are selling those narrow network option plans, so the Primary Choice or the HAP Choice, the richest benefit on those plans is that we provide coverage for Tier 1 and Tier 2 drugs through the donut hole on those two plans. So if your client was taking Lantus and they were on the HAP Primary Choice and they did mail order, they would pay nothing for their insulin until they hit the catastrophic phase. So you would literally be saving your clients thousands of dollars. Keep moving. As a reminder, we have telemedicine through MedNow, so it allows your client to get access to doctors via their smartphone, their tablet, or the computer for minor emergency or urgent care type situations. We also have the visitor traveler benefit. So if your client chooses the HMO plan and they are traveling to Florida, Arizona, or Texas, they don't just get coverage for ER and urgent care. They will also have coverage for routine care. So they can see providers in those states that accept traditional Medicare, for routine services and pay the in-network copay. I'm going to give you an example. The client is on our HMO 015 plan, the HAP Senior Choice, Senior Plus, and they want to get physical therapy done. As long as they're going to a Medicare-approved provider, they let us know who they're going to see and when. They would have a $10 copay for their physical therapy benefits. And then reminder as well, we do have Assist America built into all of our plans, which is a travel benefit. It's not traveler's insurance, meaning it's not covering deductibles and copays. It's really designed to help a member in an emergency situation when they're greater than 100 miles away from their home. So it will help transport loved ones to them. It may translate medical records. It may coordinate the insurances through the hospital they're at, as well as the health plan. So it's a wide range of services that Assist America provides. So let's recap quickly the Medigap, and then we're going to go into the special election period that I wanted to highlight with you. As a reminder, HAP offers plans A, C, D, F, G, and N. C and F are only able to be sold to select beneficiaries effective January 1st due to the macro regulations. And then what HAP has done is we have introduced a Plan D for this year. So Plan D is in David. For those of you that are not 100% familiar with D, D is the exact same plan as G, with the exception that it does not cover Part B excess charges. So Plan G does not cover the Part B deductible, but does cover Part B excess charges, where Plan D does not cover the Part B deductible or Part B excess charges. But you will see a little small reduction in premium based on the differences in those plans. So as a reminder too, with the Medigap products, you can sell those statewide, so both lower and upper peninsula. The client's rate is going to be determined off of smoker, non-smoker, gender, and attained age. And then if they have to go through underwriting, that might be a factor as well. HAP has introduced both preferred and standard rates for 2020. So your client can either, if they're going through underwriting, can either get a preferred rate, a standard rate, or maybe decline based on their medical conditions. We also have a household discount. This is going to apply when there are two individuals within the same household and they both have a Medigap policy with HAP. The only time this is not going to apply is if the two people in the household that have the Medigap policy bought it prior to January 1st of 2020. So I'm going to give you an example here. Let's say you wrote somebody in November of 2019 on a HAP Medigap plan, and then let's say the husband aged in 2020 and you now wrote the husband on a HAP Medigap policy. At that time, the husband is going to get the discount, and now the wife or the sister, whoever they live with, is going to get the discount as well, because you are submitting a new app for a Medigap policy after January 1st. The only time this is not going to apply is when you have two people who are already on a Medigap policy in the same household prior to January 1st of 2020. As a reminder as well, plans A, C, D, and F are the plans that we make available when someone has guaranteed issue for loss of creditable coverage. And then we do have competitive commissions. Most of our plans we do pay over a 10-year period, and that's $250 per year. But if you need a copy of the commission schedule, you can always reach out to Christy, or you can reach out to myself, and we'd be glad to get that to you. So let's take a look at these election periods. So I reminded you earlier that we are inside the Medicare Advantage open enrollment period right now. The Medicare Advantage open enrollment period runs between January 1st through March 31st. This is the second year that CMS has brought this enrollment period back. So we had it last year, and we're continuing to have it this year. It replaced the Medicare Advantage disenrollment period that used to be in place that allowed individuals to disenroll from Medicare Advantage between January 1st through March 14th. That is no longer applicable. This has taken its place. This enrollment period can apply to two sets of beneficiaries. Let's take a look at who it applies to. This can be used for people that are in a Medicare Advantage plan as of January 1st. So this can be somebody who did an enrollment during the Medicare Advantage annual election period, or it can be applied to someone who's been on a Medicare Advantage plan for 10 years and never made a change. If they want to make a change now, they can do so by using the Medicare Advantage open enrollment period. What it's going to allow them to do is make one election during this window. They can move from one Medicare Advantage plan to another with the same company, or they can move from one Medicare Advantage plan to another Medicare Advantage plan with a totally different carrier, or they can disenroll from Medicare Advantage and go back to traditional Medicare and buy a standalone prescription drug plan if they choose to do so. So if you run into a beneficiary today or tomorrow or over the next 90 days that is in a Medicare Advantage plan and they want to make a change, they can do so by using this enrollment period. They can switch to another Medicare Advantage plan or disenroll from MA and go back to traditional Medicare and buy a PDP. The other set of beneficiaries that this would apply to is for people who are aging into Medicare and used their initial coverage election period and chose a Medicare Advantage plan. Those people also get a Medicare Advantage open enrollment period, and their Medicare Advantage open enrollment period is going to depend on when their entitlement was for Part A and Part B. So their window is going to be the last day of the third month of entitlement. So I'll give you an example. Someone turns 65, they have their Part A and Part B, and they turn 65 on May of 2019 is when their eligibility went into force. They enrolled into Medicare Advantage May 1st. They will have an MA OEP that will go May, June, and July. So they can switch through those months even though they elected a Medicare Advantage plan when they first aged in. So remember, their OEP occurs depending upon their Part A and B entitlement date. Moving through, a couple of the things you'll want to keep in mind. We mentioned what you can and can't do. So you can move to another MA plan or you can disenroll from MA and go back to traditional Medicare and buy a PDP. Please pay attention to the first bullet that is on this slide. MA OEP does not follow the AEP last app in rule. So as we know, during the annual election period that runs between October 15th through December 7th, individuals can enroll into submit as many applications as they wanted to. They can submit 10 applications into 10 different plans. Whatever application is submitted last is the one that goes into effect on January 1st. However, during the Medicare Advantage open enrollment period, that is not the case. It is the first application in is the one that is going to stick. So if your client, let's say, submits an application today using the Medicare Advantage open enrollment period, and they want to, let's say, move from HAP to Humana, and then let's say they called you back a week later and said, you know what, I know you presented Blue Cross to me, and I enrolled into Humana, but I want to go with the Blue Cross plan. You cannot submit an application for Blue Cross because it will not get processed. The Humana application was the first one in, so that is the application that is going to get a process and go into effect. The way that you can get them Blue Cross is they will have to call Humana, cancel that enrollment, which is going to open back up the Medicare Advantage open enrollment period and allow you to submit an app for Blue Cross Blue Shield, which will now be the application that will get processed. So as a reminder, it is not the last app in during the Medicare Advantage open enrollment period. It is the first application that sticks. If they chose Humana and the policy went into force, so it already became active and they now want to switch, they cannot. They cannot use the MA OEP at that time. That enrollment was used. It's gone for the rest of the year. They have to stick with that application because it went into force. The only time you're going to be able to cancel the enrollment is if it did not go into effect. The other thing you want to remember is that the effective date for the applications submitted during the Medicare Advantage open enrollment period is always going to be the first of the month following the receipt of the enrollment request. I'm going to give you an example. You submit an application in January for a client doing MA OEP, and you cannot request a March 1st or an April 1st effective date. They will automatically get a February 1st effective date because the application was submitted in January. So if they want a March 1st effective date, you need to wait to submit the application and submit it in February. The MA OEP does not apply to individuals who are enrolled into a standalone PDP or those that have just traditional Medicare. So if someone's in a Medigap plan and a PDP plan and they now want a Medicare Advantage, their window to switch was Medicare Advantage annual election period. They cannot use the MA OEP. A couple other things that you want to understand is that you are not going to see any TV ads. You're not going to see any billboards, HAP, Blue Cross, Priority. No one's mailing out anything to beneficiaries regarding this open enrollment period. It is prohibited by CMS to target or market during this election period. So let's take a look at what plans and agents can do during this window. You can send marketing materials when requested by a beneficiary. So if a beneficiary reaches out to you and says, can you send me information on PAP? Absolutely, you can send them and get them the information that they request. If an individual wants to meet with you, you have the ability to do so you can continue to conduct sales meetings if it's requested by the beneficiary. You can provide information or respond to questions on OEP when asked. So if a beneficiary is savvy enough and they know that this period is out there and they call you and say, I've heard about this other enrollment period, can you tell me about it? Yes, you can then talk about it. If they don't bring it up, what is going to trigger the permission to allow you to bring it up is if they express any type of dissatisfaction. That is the indicator. If they call you or you're in a conversation with a beneficiary and they show any type of dissatisfaction with their current coverage, you then have the legal right, or you are in compliance to be able to say, well, did you know you have the opportunity to change, and let me explain what your options are. So if they say, I had to wait on customer service 2 hours to get through, I am so upset, or my ID card didn't come, or that person on customer service was so rude to me, any type of dissatisfaction that is expressed by the beneficiary allows you to bring up this enrollment period to let them know that they can make a change if they choose to do so. You can also continue to market to individuals that are aging into Medicare and those that might have LIS or the dual eligible. So you can continue to do your educational seminars. You can continue to do your sales seminars. What you cannot do is you cannot mail out marketing pieces that say it's not too late to make a change. There's another enrollment period that runs between January 1st through March 31st. You can't put stuff on social media talking about this enrollment period. You cannot knowingly target and market during this window. Let's take a look at what you can't do, and I pretty much summed that up right there, is that you can't promote or engage in agent activities that intend to use this OEP as an opportunity to make further sales. All you can do is provide information, and respond to questions when you are asked. You cannot send unsolicited marketing material advertising this period, and you cannot target beneficiaries who made changes during AEP. And this would include purchasing mailing lists of such individuals and market to them. So let me kind of explain that last bullet. Now, if your client that you moved them from Priority Health over to HAP, you can reach out to them and say, we're within the first month or the first 90 days. I just wanted to reach out to you and see how things are going, any issues. And if they start to bring up issues, you can bring up the enrollment period. What you can't do is if you lost clients during the annual election period, they fell off your book of business and you realize that, you can't reach out to them and say, I see you left me. Did you want to move back to me? I have the opportunity to switch you back. That is what is prohibited. But you can service your existing clients during this window. Moving on to the next enrollment period that I want to discuss with you is the other creditable coverage. The reason that HAP is addressing this or bringing this enrollment period up is because we offer an MA-only plan. For those of you that are on the line here, you know that the MA-only plan has a target market to select beneficiaries, one of them being VA beneficiaries. So what this enrollment period does, or this SEP does, is it allows individuals that are currently enrolled into an MAPD or a PDP who have other creditable coverage available to them the opportunity to disenroll from that MAPD or PDP and go and buy an MA-only plan. This SEP may be used all year long. So I'm going to give you a scenario where you may run into a situation where you can use this. So let's say you run into a VA beneficiary and they're on a PDP plan, or they might have an MAPD plan. So some of the VA beneficiaries will buy those $0 MAPD products to get the gym membership, the dental, the over-the-counter, whatever it may be. They technically don't need prescription drug coverage because they have credible coverage through the VA. So you would be able to remove them from the MAPD plan and put them into our MA-only plan because remember, we are paying them $50 a month to take our MA-only plan. It doesn't include drug coverage, but it's very rich in coverage. I'll give you some examples. It has no medical deductible. It has a $0 PCP. It has a $20 specialty doctor visit. It has $0 PT, OT, ST mental health, $0 diagnostic labs. You're getting a $75 over-the-counter. You're getting a gym membership. You're getting the dental benefit. You're getting the vision and the hearing all built in as well. And we're paying the member $50 a month to take it. We also have a flyer that you can use that's CMS approved that you can order where you can enter your agent information in there so you can target market to these type of folks. But that's really what this SEP is for. It's for individuals that want to move off of a plan that includes prescription drug coverage to go back to the other creditable coverage that's available to them, such as VA benefits. Let's move to the next one, which is CMS and state-initiated enrollments. I'm sure you are all aware that CMS and the state of Michigan does auto-enroll people into plans for several reasons. Most of the time you will see this as if they're dual eligible. We all know that if they're auto-enrolled, they don't have to keep the plan that the state or CMS gives them. They have the opportunity to make a change if they want to. What's different or unique about this SEP is that this is not like a standard SEP that lasts 60 days or 62 days. This SEP lasts 90 days. So if an individual is automatically enrolled by CMS or the state into a plan, they have an SEP to disenroll from that plan and enroll into a different plan. This gives them a one-time election within 3 months of the effective date of that auto-enrollment or notification of the assignment into the plan, whichever is later. The SEP must be used within 3 months of the start of the coverage and receiving the plan. There are times that individuals are automatically enrolled by the state, but they're not notified till maybe a month or greater after the plan went into effect. If they weren't notified till a month later, their 90-day window starts when they were notified. So you would be able to move them off of those auto-enrolled plans and put them into a plan that fits their needs using this SEP. So with the MMP program in the state of Michigan, in certain counties, beneficiaries are auto-enrolled when they're dual eligible. If the client wants to keep the plan they have and they're getting auto-enrolled and they're within those counties that the MMP program does that, you can have them call Michigan Enrolls and get them to opt out of that auto-enrollment process so they stop bumping them out of the plan that they want. If you need additional information, you can always reach out to me and I can assist you with that. But just know with this SEP, it lasts 90 days and it gives you the ability to get them into a new plan. Let's look at the State Pharmaceutical Assistance Program. So for those of you that have analyzed a enrollment form with carriers and you look at all the SEPs, you've probably seen this one on here. Some of you may not be familiar with it or what you can do here. I'll be very transparent. This one is probably going to be one where you're going to use if you ever run into those folks that are mid-year that only have traditional Medicare. There are times where agents run into people who just have the red, white, and blue card and they want to get additional coverage, but they have no other SEP to get one. You could potentially use this to get them into a Medicare Advantage plan, and I'll explain. The state of Michigan, fortunately enough, has an SPAP program. So not all states across the country have this, but Michigan does. So individuals who are enrolled into an SPAP are eligible for a one-time SEP to make an election anytime throughout the calendar year. Individuals may use this SEP to switch from original Medicare without PDP to original Medicare with PDP, or to an MAPD plan, or from an MA-only plan to a PDP or an MAPD plan. So let me give you an example here of what how this would work and what you would need to do and who qualifies. So the State Pharmaceutical Assistance Program through the state of Michigan, in order to qualify for this, an individual must be a Michigan resident. They cannot have any other prescription drug coverage in place, and they have to have an income level at or below the state's median income household level, which you see here listed. So for an individual, it's $31,200. For a couple, it's $42,000. So keep in mind, right, we all know LIS is out there, and that's typically about $16,400 or less, which is going to qualify an individual. You can see this right here is significantly higher. So most of your clients would probably get qualified for this based on their income. So as long as they meet these requirements and they have no other drug coverage in place, you can assist them enrolling into the State Pharmaceutical Assistance Program with this brochure here. Very basic information they're asking. They want their name, their date of birth, their demographics, any people that reside in the household, their signature, and their date. The beneficiary would then get an approval letter back with the blue card here. When they get that, it's going to open up an SEP to allow you to enroll them into a Medicare Advantage plan that includes drug coverage or a prescription drug plan. When you enroll them into one of those two options, it is going to cancel out their SPAP coverage. So you're only using this State Pharmaceutical Assistance Program to open up an SEP. So remember, this is going to be probably best fit for somebody that you run into mid-year that just has the red, white, and blue card. So let's move into dual eligible and LIS folks. So this is, most of you are aware of this. This changed last year to where members are not allowed to make changes once a month. It's now once a quarter. And this would be for those that have both Medicare and Medicaid, or those that receive low-income subsidy or extra help through the Social Security Administration. The SEP allows an individual to enroll or disenroll from an MA plan once per calendar quarter during the first 9 months of the year. The SEP can be used between January through March, which is the first quarter, the second quarter, the third quarter. It cannot be used between October and December, because during that window, if they want to make a change, you should be using the annual election period. A couple things you'll want to remember. The SEP is considered used based on the month in which the individual makes the election. So for example, the application is taken. So if we receive the election in March, which would be an April 1st effective date, you're technically using the SEP for the first quarter. So it's based on when the application is received. So in this particular example, you submitted an application in March using this SEP. They're going to get their new plan April 1st. They could technically turn around and submit a new application using this SEP in April to get a May 1st, because they're now using their second quarter election. So the way that we're determining this is based on when the app is received, not the effective date. As a reminder, the effective date of the enrollment request made using this SEP is always going to be the first of the following month receiving the enrollment. So when you use any of these SEPs and you submit an application, you're not going to see where it's going to allow you to pick the effective date. It is automatically going to be assigned to them based on when we receive the application. So if we receive the application in March, they will automatically get an April 1st effective date. You cannot request May or June. If we receive it in April, you will automatically get a May 1st effective date. Let's move to the next one. There's individuals who gain, lose, or have a change in their dual or LIS status. So we just talked about people who just are kind of stagnant with their Medicare and Medicaid and their LIS, but there are people who have changes throughout the year. So maybe they lose their Medicaid, or maybe they move to a spend down, or maybe they have a change in their LIS level. This is the SEP you're going to want to use when that happens, because one, it's going to allow you to save the other SEP, the once per quarter one, for another change if they want to use it later on down the road. So with this one, individuals have a one-time opportunity to make an election within the first 3 months. So this is another 90-day SEP. So if you have an individual that you run into, and let's say they lost their Medicaid 2 months ago, and you're thinking, oh man, you're outside the window to make a change because it's been greater than 62 days. No, they have 90 days. So you will be able to use this SEP to get them into a new plan. And once again, as a reminder, the effective date for the enrollment under this SEP is the first day of the month following the receipt of the application. So that is the end of the SEPs that we wanted to go over. As a reminder, there are several other SEPs out there that will allow clients to make changes mid-year. So if you're ever in a unique situation with a client, you can always feel free to reach out to me and run something by me, and I can always look under the CMS regs to see if there's a way or a possibility to get them moved mid-year. But those are the most commonly used ones. Those are the ones that agents find that I get the most questions on, I guess I could say. So those are the ones that we wanted to highlight with you. I did mention retention efforts. So last year, during the Medicare Advantage open enrollment period with all carriers, there was not a whole lot of movement. There was a little bit of movement from plan to plan, but we are anticipating now that more beneficiaries are becoming savvier. Agents are becoming aware of this enrollment period, that we do anticipate maybe there might be some more movement during this window. And we all know there's the telemarketers out there that are not compliant, and they're calling these seniors, and they can easily move them, even though it's out of compliance, into these new plans using this election period. So what we're doing at HAP is we are going to be sending out weekly term reports so that way we can help you manage your clients. Now, I just sent out this week's report yesterday, so if you didn't get an email from me, it's because you didn't have a client on there. But if you would have received the email, you would see it looks exactly like this or very similar, where it's going to have your client's name, your name, the date that they are being disenrolled, the date we received the request, the reason they're disenrolling, and the new plan that they're going to. So we do find that most of the time, or some of the time, the agent knows this because they move the client, and we understand that. We're not trying to reach out to you being like, why are you doing this? Because we understand you have to do what's best for your customer. But there are times where the agent has no idea, or even the beneficiary has no idea, and you call them and they say, I talked to somebody over the phone, but I didn't give them permission to enroll me. Well, that will allow you to be able to intervene to make sure that you get things straightened out before the change happens. You're also going to see, I'll give you some examples, it's not just for MAOAP. You're going to see maybe like your client passed away. That's just an FYI to let you know to manage your book of business. You might see something on there that says MMP, to where the state is moving them. So we talked about that SEP, what you can do in that situation and how you can retain that client if you choose to do so. So just know we will be sending those out weekly. If you don't get one, it's because your name does not generate on the list. The other thing I want to mention really quickly before we close this out is that, remember, we have an easy enrollment tool. For those of you that submitted applications with us, you can probably attest to that our application is super simple, and once you get comfortable with it, it should take you less than 5 minutes. But as a reminder, you're able to compare plans side by side back there. You can look up preferred pharmacies. You can view the RX monthly cost breakdown. And then you can enroll not only your Medicare Advantage clients back there, but also the Medicare Supplement clients as well. But with that being said, we're at the end of the presentation. Hopefully you learned something or were brushed up on something that maybe you needed a little bit more knowledge on. But I want to thank all of you, one, for attending the webinar, and I want to thank all of you for the business that you wrote during the annual election period with HAP. At this time, I feel like we can maybe open it up if anybody has any questions, or feel free to always reach out to me. I make myself available. You can call me, email me, or text me, and I'd be glad to work with you to answer your questions. But at this time, I'll turn it back over to Christy and open it up from there.
Thank you, Kevin. That was very enlightening, especially about when you were talking about SPAP. I wasn't aware of that, so that's really important. So I'm looking to see if anybody has any questions. And honestly, I'm not seeing anybody's hand raised or any questions. So I will give you back this portion of your day so you can go ahead. We do appreciate your hard work, and feel free to reach out to me. If not, I will be reaching out to you within the next few days and just chatting with you about HAP and just some of the opportunities. Again, Kevin, thank you for your time. We appreciate the partnership and look forward to having a really prosperous 2020.
Great. Thank you all. Have a good weekend.